Hi, this is Dr. Bishai at the Harford County Health Department. Here's an update on COVID-19 in Harford County for April 5 through 12. The Harford County positivity rate, this is the percent of tests that have come back positive, is running around 9.8% this week. That's almost close to its record of 9.88%. In fact, Saturday we did exceed the record and we hit 10% for the first time in history. Our COVID positivity rate has gone up in the last 3 to 4 weeks, and along with the Harford County positivity rate, the number of cases per day per 100,000 is now running around 34 positive cases detected every day per 100,000 people. These are very high rates of COVID, and at the health department we've been exploring what's responsible for this rise in the number of positive cases. If we look into who is getting these positive cases, we see that we're in a fourth wave. The first wave happened here in April and May of 2020. The second wave in July, August of 2020. The third wave happened starting in November down to January of 2021. We hit a low point in March 1, and now the age group 20 to 59 is really responsible for the rise in the number of COVID positive cases this week in early April. We look in other age groups and there aren't similar patterns. These are children ages 0 to 9 and they're running about the same amount of COVID they've had since November. I'm happy to say that the return to in-person schooling here at the beginning of March really doesn't show a whole lot has changed for this group compared to where they were throughout February, January, and December. So that's good news. When we look at seniors, also good news. The seniors in the county had very high rates of COVID positivity in the third wave from November to January, but they are really not spiking up here in the fourth wave. In fact, the seniors of Harford County are not having a fourth wave of COVID, and we attribute this to the high coverage of COVID vaccines for them. In the middle are youth ages 10 to 19. And these positive cases are going up in the fourth wave. Most of this is older teens, 18 and 19, perhaps end of high school, early adulthood. They are actually having some increase. We're not seeing these increases in preteens and in middle schoolers. So this is something that is of concern to us, that older teens are showing increases in COVID. The vaccines do appear to be protecting groups in the community. I want to call your attention to this blue line here. This is healthcare workers. And of all of the groups in the county, there have been police and childcare, barbers, retailers. All of them are having the same rate of COVID before December 13th and after December 13th when we started vaccinating. Healthcare workers started getting vaccinated in December. And if you look at what's happened to them, they've had a real reduction in how much COVID healthcare workers are getting. And so we want that same decline in COVID cases to occur for all of the other workers in the county, and vaccines can do the trick. Hospitalizations are up for that middle-aged 20 to 59-year-old group. They're having a higher than ever before rates of hospitalization, and in the last 7 days we've seen a lot of admissions in adults ages 20 to 59. Seniors 70 and up, their rates of hospitalization are much lower than they were in the winter between December and January. And again, that appears to be that COVID vaccines are working. The great news that I'm here to share with you today is a report by the CDC that came out on April 2nd that says that COVID vaccines not only protect the people who get them from getting moderate, severe COVID, and it prevents death from COVID, but COVID vaccines lower the chance that a vaccine recipient will infect other people. And this was evidence that was brought out in the U.S., Scotland, and Israel. If here, we'll turn on the Arundel cam, and I'm live from a little model of the city of Arundel where we have several people representing a chain of transmission. And if knock over hands over here, go Hans, and go Hans, down they go, because there's no protection in the middle of the chain. But let me intercede here, and I'm going to go and deliver a vaccine. I'm ready to give her shot, and this won't hurt a bit. Ouch. Okay. Anna's got her shot, and what I'm going to do with her, I'm going to put a little bit of sticky tape underneath her to represent her reduced likelihood of transmitting COVID. And now, when I try to start a chain of transmission of COVID, I'm going to give Sven here, I think this is Sven, a little bit of COVID, and down he goes. It stops. And because Anna's been vaccinated, the COVID transmission stops with her, and we protect all of the rest of the citizens of Arundel behind her, and they don't get COVID. So this is what we've learned this week, how COVID transmission is reduced when we use vaccines. Great news, a real reason to go get vaccinated to protect everybody around you. In terms of the safety of vaccines, we've seen no new long-term side effects for these vaccines. We've given out 160 million doses in the USA. And the short-term side effects haven't changed. People who get the shot report that they get pain in the arm where they were injected. Goes away after 1 or 2 days. Fatigue, malaise, and fever for maybe 2 to 3 days. And some people get no side effects at all. None of these side effects go on past 2 to 3 days. 36% of the citizens of Harford County have had at least one dose of COVID vaccine. 41% of women have been receiving at least one vaccine, 31% of men. There's a racial disparity where about 35% of whites have received one dose of vaccine at least, and 23% of blacks. The good news is that seniors are well covered. 80% of seniors over 65 have been covered with COVID vaccine, at least one shot, and we'll soon get them full coverage. There are gaps geographically. If you notice that the pinkish color are lighting up in the Route 40 corridor, in both Edgewood, where there's low coverage, and in Aberdeen. Up at the top of the county, we have low coverage along the Pennsylvania border, and we're hoping that new sites opening up at Ripken Stadium mass vaccine site, as well as a new site that we're opening in Edgewood, will help with this. The number of people getting a first dose per week has been going up throughout the middle of February. We see this great increase in the number of Harford County residents getting vaccinated in total. The health department has been running steady with close to 2,000 vaccines every week. But in the county, we're getting 8,000 people getting shots every single week. So in summary, we are in a fourth wave of COVID-19. We're showing among the highest rates ever recorded. This is the time to get vaccinated. The more doses are coming. Eligibility is going to be open to everybody over age of 16 starting on Monday. So if you're in the age 20 to 60 group, you're eligible to get vaccinated as of today in any of the mass vac sites, and starting on Monday throughout the county, you are eligible. And because there is such high risk, this is the time to go out and get vaccinated. The vaccines are working. The people who've gotten them have shown that they are getting less COVID. The seniors are becoming out of harm's way. The healthcare workers, their rates are going down. We really want that coverage. There are gaps. We're seeing a need to reach men and African Americans. Please encourage everybody in the county to get vaccinated. More vaccines are coming. They're already here. If you want to sign up for a vaccine slot with Harford County Health Department, please go to our website, call our hotline, and we'll get you vaccinated. Thanks for listening.